Good afternoon. We are going to go ahead and get started with our presentation today. Thank you all for being here. So good afternoon. It is a pleasure to be here today discussing one of my favorite topics, which is the well-being of our children. I speak to you today not only as a licensed therapist specializing in trauma therapy with children and families, but most importantly, as a parent myself of two teenage daughters. I find that it's been one of the most rewarding roles I've ever fulfilled, as well as the most challenging. I would venture that I've experienced some similar challenges to those parents and caregivers that are on the call. And I hope that this discussion can help provide some insight as to how you can help your child cope with the continual challenges posed by the pandemic, and also to share some knowledge about the mental health issues experienced by children in our community and how we can best support one another. I want to thank each one of you for taking the time to discuss these issues. It clearly demonstrates your commitment and love for your children and the children in our community. I also emphasize that parents are one of the strongest protective factors to combat against adverse childhood experiences, and therefore that means that you have one of the most important roles on the planet. We will have a question and answer session after the presentation is over. If we are not able to get to all of your questions, please email us at pr@tmh.org, and we will gladly provide additional answers. And with that, we will go ahead and begin our presentation. And while we're going through this, please feel free to use the Q&A function. Okay, let me pull this up. So since children, comprise approximately 28% of the population, we know that COVID has had the potential for great impacts in unprecedented ways on children. The quality and magnitude of COVID's impact on minors is probably best understood by many vulnerability factors, and we're going to go through a couple of these. This is not an exhaustive list. It's important to remember that compared to adults, the pandemic has had great magnitude, or the potential for great magnitude, on the emotional and social development of children and adolescents. So let's discuss some of the risk factors. Developmental age. So we're going to go through the various stages and how younger children are impacted very differently from older children. We know that, from birth to even up to 24 is a time of rapid and continual development. Younger and older children have different needs. Education status. We know that children of all age ranges cannot understand the complexities associated with the pandemic. Special needs. For those of you who have special needs children, we know that the increased risk of, intolerance to uncertainty, changes in routines, has definitely impacted them. There's also an increased risk of regression for these children. Children who already have pre-existing mental health conditions. Increased stress can heighten symptoms of depression and anxiety in these children. We have certainly seen an increased, inpatient admissions here in our community with children starting at the age of 6. Being quarantined or having a parent quarantine. There are lots of children who are children of essential workers, so their parents have been in action the entire pandemic. There are also children that have dealt with a lot of trauma or grief due to loss. Lengthy periods for children of social isolation and lack of social engagement, and we're going to touch on this in more depth and how this impacts kids in a variety of ways. Particularly how it impacts those from 10 up until the age of 18. Extracurricular activities. We know that these are very important to kids. They get their self-identity, their sense of community through activities, and this disruption has definitely caused some lack of engaging in normal positive activities. One of the things that we may not think about is underprivileged children. With these children, they may have gotten a lot of sense of security from their schools and their community. Many of these children may have depended on their school system for meals. And so when we look at this, we look at closures, that's also heightened our social inequities. So these are just a few risk factors to pay attention to. Again, this is not an exhaustive list, but I do want you to kind of know what those risk factors entail. So, let's talk about some of the common symptoms and behaviors associated with stress. I want everyone to understand on the call that each child is different. Even those parents on this call that have multiple children in your home, you know that they all have different personalities. They cope very differently. So there's no one size fits all regarding your child and how they're going to experience, internalize, or cope with this pandemic. What I do want you to understand is that children may develop, emotionally pent-up feelings of distress, which they can internalize. And sometimes, internalizing of feelings results in acting out behaviors. Also understanding that children have limitations with the knowledge and maturity needed to understand the implications of the pandemic. And ultimately knowing that the impact of the pandemic for children is primarily going to be heavily on their emotional and social development. So some of the symptoms that you may see, these are just a couple: sadness, fear, anxiety, acting out behaviors, crying, irritability, grief, anger, and boredom. And I want you to understand that for kids, they're going to experience an array of emotions with this pandemic. This does not mean that they're in crisis because they are exhibiting these emotions. It just means that, these are things that you should pay close attention to. If you're noticing that your child is sad more days than not, if they're anxious more days than not, if it's starting to impact their functioning, then those are things that you're really going to want to monitor and pay attention to. But know that there's going to be periods of irritability. This is normal because there's changes in their routine. There's uncertainty. Knowing for adolescents that there's going to be components of boredom here. And so again, these are just symptoms that you need to pay attention to if they start impacting your child's overall functioning. So let's talk about the role of parents for young children. We know that young children demand more direct attention. It's very important to engage them in play-related activities, both indoor and outdoor if you can. Interruptions in play affect affect in young children. You want to make sure that you're providing them with a lot of positive reassurance and attention. So instead of focusing on the days where they may be more irritable or they may be more cranky, try really focusing a lot of attention and reassurance on positive feelings and emotions and affect. Help them understand COVID based on their developmental level. There are a ton of free resources that are available that include cartoons, videos, age-appropriate books, and we'll give you an example of one of those in a minute. But these are things that, again, there's a ton of resources. CDC has things for all age levels. Involve them in prevention activities. Help them understand why hand hygiene is important. Help them understand why wearing a mask is important, and help them understand that, again, based on where they are developmentally. For younger children, it's really important to avoid exposure to things that are, again, over their developmental level, their ability to understand. So distressing news and media that use language that they can't comprehend and understand should be avoided if you can. Engage older siblings in this process. Older siblings can be the best support system and the best role models for the younger siblings. Be a model as a family for prevention. So, showing kids of all ages that, the parents are how they're coping, demonstrating positive coping skills, showing them that they're engaging in these positive preventions is really, really important. Also, I can't stress this enough, be patient. Understand that acting out behavior is going to be normal. This is a time of continual change, uncertainty, a time of considerable stress for families across the world. So just be patient with your children. Know the warning signs and symptoms of behaviors that require mental health intervention, and we're going to delve into these a little bit more. But know some of those symptoms that we discussed in the previous slide, and just pay attention to your child's overall functioning. If your child is typically a normal, bouncy child that it engages in play and is curious, and you're noticing for several days that their affect is more sad and withdrawn, those are things that you want to pay attention to. It's also important to understand that infants and toddlers are not immune to stress. They take their cues primarily from their parents. And again, for younger children, what you're going to mostly see is irritability. You may see some levels of separation anxiety. Animal models have demonstrated that a mother's prenatal stress can impair normal brain development. But, parents are both protective factors against adverse childhood experiences. So I want to stress that, you are the best protective factors here. So this is a book, My Hero Is You, How Kids Can Fight COVID-19. This book was developed by the Interagency Standing Committee Reference Group on Mental Health. It contained input from 1,700 children, parents, caregivers, teachers from around the world, and took into account how each family from different cultures and backgrounds, how they were coping with the pandemic, and included it in a book. This is recommended for ages 6 to 11. It's a wonderful book. It contains, language that is easily understood by this age group, lots of pictures, and I think, just shows kids that, again, this is a worldwide pandemic and that other families are struggling very similarly with the effects of this. And it helps them be a part of developing positive coping skills. After the call, we will share the link in the Facebook event for this book. So let's talk about the role of parents for adolescents. And adolescence spans from the ages of 10 to 24. I think it's important for older children that we, as opposed to younger children and being more directive, that we're more open about discussions with the pandemic. Again, you are the best role model for them, and they do pay attention. So they're taking their cues about how you're coping with stress, about how you're dealing with the financial stressors, the job uncertainties, just the overall stressors of quarantines. They're taking their cues from you as to how you're handling this. It's okay to explain to your children that there's going to be days for you where you're struggling as well. But you're demonstrating positive coping skills and helping them understand that this is going to get better. Helping them understand, again, the importance of prevention that goes all across the board, younger children all the way up to adolescents, helping them be a part of that, and helping them understand what's happening with the pandemic. This age group is much more responsive to understanding, more detailed information about the pandemic. But it's also important to ask them, and I say this, I emphasize this, check in with your kids on a daily basis, even when you think they don't want you to. Be present at their room, knock on their door, sit by their bedside, ask them how they're feeling. And don't assume just because you think that your child is doing well in Digital Academy or they're adjusting well, that means they're coping okay and they're feeling great. Sometimes with this age group, they're internalizing feelings, and so it's just very important to continue to engage them in a dialogue about how they're feeling. Helping also engage your child in a daily routine. This is so important for the Digital Academy kids, and I know kids are starting to go back to school more and more, but routine is very important. If you do have a child that's doing Digital Academy, make sure that they're getting up, that they're engaging in schoolwork outside of the bedroom. Try to mimic a classroom in the best way that you're able to. Allow them time to engage in some form of social contact. And I say this in a safe way, obviously. We're going to talk about the role of social media in a few minutes. It's really so important developmentally for this age group that they connect socially with peers in some way. It's also important because there is a potential for more idle time for you to monitor what they're doing while they're on social media. Again, ask them what you can do to help and be patient. Home is still the best place to learn and mimic positive coping skills. Parents are essential to demonstrating these. This is a great opportunity for older children during this time to learn additional responsibilities, accountabilities, to help them contribute to the overall home environment. But it's also a time to realize that they are still kids. So let's talk a little bit about the effects of social deprivation and mental health in adolescence. I think sometimes we forget this. Kids during this age, and again, let's talk about 10 all the way up to 24, 25. We know the majority of brain development happens between birth to about 5, but we're still developing a lot of our social and emotional development all the way up to 24, 25. There's an increased sensitivity to social stimuli and a heightened need for peer contact during this time. So long periods of social isolation can have far-reaching consequences. And we know that there's more study that's needed for this to kind of look at how brain development is affected. Some models have solely looked on kind of how solitary confinement has impacted kids in incarceration. But for the purposes of this, let's just talk about vulnerabilities to social deprivation in adolescence. We know that this is a period of rapid hormonal and biological changes. One day your 10-year-old may look like a 10-year-old, and the next day, the next year or two, they're very much looking like a young adult. This is a period of enhanced psychological and social change. They're developing more peer relationships. There's also more emphasis on peer approval and rejection. I want you to realize that before the pandemic, most adolescents spent most of their time with peers. They spent more time with peers than they did with their family members. This is a markedly more sensitive time to, again, peer development. And I want you to understand that as long as the brain is in formation, there's a lot of chances for things to go wrong, but there's also a lot of chance for things to go right. So during this time, looking at kind of maintaining the overall peer relationships and understanding how important this is to self-identity. So for example, let's talk about kids that are currently in a digital academy setting. It's really, really important for these kids to maintain connectivity to peers in some form. And we're going to talk about that in just a minute and how to do that. It's important for kids all across the age group, though, to still have opportunities to engage with peers. We know that positive peer relationships can be a major protective factor in relation to mental illness, and it can foster resilience. There's also, a risk for kids who are more isolated to develop affective conditions, increased anxieties and depression. So again, just pay attention to how social deprivation can be affecting your child during this time. So let's talk about adolescence and digital technology, some of our favorite topic, right? So the average US teen spends 4 hours a day on social media. And I know that sounds kind of staggering, but that's the average. Isolation can alter neural patterns. I thought this was very interesting, similar to food deprivation. So cravings of social interaction after periods of isolation can actually mimic food cravings after fasting. So think about that in terms of your child, and think about, how they're yearning for that peer interaction. Lack of social interaction, again, during this time can potentially contribute to behavioral and brain level changes. But most importantly, again, this is where they are getting the majority of their social identity. This generation are really the first large-scale utilizers of digital technology, meaning social media, smartphones. Digital interactions challenge our traditional thoughts and concepts of what constitutes socializing. I think about if this pandemic had hit when I was a teenager, The challenge would have been a landline. I wouldn't have been able to see the faces of my peers. I would not have been able to see loved ones. We would not have been able to do webinars or Zoom calls. So there's a lot in terms of digital technology that can be very positive during this time frame, and so use that. Allow your child incremental use of digital technology. Understand that this is their world. It's not going away. It's only going to enhance. Allow them to do Zoom calls. Get on webinars with them. Find things that are fun things that you can engage in with them. Allow them to be part of picking those things. And again, utilize social media to mitigate periods of physical distancing. My girls use a lot of FaceTime to have group chats where, I'll hear them laughing about, all sorts of things. So again, that's still a social connection, while not having that physical connectivity. And it really makes a difference for this age group. Again, understanding that social media platforms for ages 13 to 7 are already an integrated part of their daily life. And so again, when monitored appropriately, they can be very positive forms of coping. There's a reported 81% of adolescents have indicated that social media actually helps them feel connected with peers and actually has some positive effects. We have seen that neural reward systems can be activated just by positive interactions. So again, sharing a joke on FaceTime, being able to engage in eye contact and talk about feelings with your friends. And please understand the adolescent brain is not fully developed, and therefore helping nurture positive means of coping is imperative. While adolescents require opportunities for peer interaction, they continue to need steering, obviously, from the adults in their lives. And again, I highlight this: your interactions during the pandemic can make all the difference in how your child is coping. So I'm going to touch on this just briefly in the role of teachers, mentors, the support groups, and encouragers out there. George Washington University actually has released trauma-informed instruction strategies, which include, consistent structure and routine, the role that teachers and mentors can have in helping develop emotional resilience by making kids feel a sense of belonging and safety in the classroom. It's really important for everyone to know the risk factors that make students more susceptible to stress. And we talked about a few of those in the very first slide. But, kids who have exposure to family illnesses or sicknesses themselves, food instabilities, those children that are increased risk of social isolation or exposure to social inequities, housing and financial insecurities, and instability in the home environment are all subject to adverse stress-related outcomes. So knowing that is really important. And if, as a parent, you know that your child falls into one of these risk factors, please, please, please communicate with your teachers and your social workers and your guidance counselors at school. It's really important because teachers can't know every student's family or home environment or what they're struggling with. You as a parent are their biggest advocate. It's also, again, just very important to know that children and adolescents will have some predictable changes in mood and behavior. So please don't panic. There are a lot of changes happening rapidly, continually with this pandemic. And so it's going to be natural that, there are going to be times where they're just not feeling themselves. We talked a lot about, how this pandemic can affect or inhibit kind of social and emotional growth, but can also, kind of enhance it as well. So I thought this was interesting food for thought. Adolescents are experiencing unprecedented growth in social learning and development due to the repeated pandemic-related quarantines and social inequities. And this is comparable to the intensity of cognitive growth seen from birth to toddler age 3. So I thought that was really interesting. So, For some of our older adolescents, they have gained greater autonomy during this time, greater responsibilities. So if you think about it, there's also been opportunities here for a lot of growth potential as well. So I found that interesting. So let's talk about the difference between mental health and mental disorders. I think sometimes what happens is these are used interchangeably and they are very different. So we all have mental health. We all need to take care of our mental health and our mental well-being. What does mental health mean in children? That means, they're reaching their developmental, emotional, and social milestones. They're able to utilize positive coping skills, and that's when navigating their school, home, and community. That's what a mentally well child is able to do. There's a difference with mental health disorders in children. These involve significant changes in learning, behaving, and managing emotions, which cause difficulty in functioning in the primary areas, school, home, and community. I again can't stress this enough that mental health disorders are highly treatable. And so they just require early intervention, early diagnosis, so that you can get your child back on track and that healthy development is not impacted. So the Centers for Disease Control released some data where they broke out diagnosis by age group, and this is very consistent with what we see here at TMH Behavioral Health Center with these age ranges. Your rates of depression increase from early adolescence up to late adolescence. Anxiety is the same. Primarily what you're seeing in your younger subset of children, so 3 up until about 11, is primarily behavioral disorders. The primary disorders that you see with kids, anxiety is probably the biggest one, depression and adjustment disorders. What you may see an increased risk of during this pandemic is OCD, and that's obsessive compulsive disorder. We have seen kids develop a heightened sense of fear of developing COVID, germs. Again, it doesn't mean that just because your child is exhibiting more of those symptoms that they have the diagnosis of OCD, but there are things to watch for and just look at how it's impacting their overall functioning. So I thought this was very interesting too. I wanted everyone to understand how mental health rates have changed during the pandemic. CDC looked at data from the National Emergency Room Surveillance, and this was data from January to October of 2020, but it also compared it to the same period in 2019 pre-pandemic. If you look at, the ER visits for mental health issues increased 24% for children ages 5 to 11. ER visits for children aged 12 to 17 increased by 31%. This group had the highest number of ED visits for 2019 and 2020. And I can tell you this is very consistent with what we are currently experiencing in our community with this age group. All of these ED visits included a component of stress, anxiety, PTSD, or panic. And I will tell you that we have more children in our community that are overdosing on over-the-counter medications, Tylenols, more aspirin overdoses, lots of younger children ending up in our ICU. And we also have, between the ages of 12 to about 18, we have more children in our community dying via self-inflicted gunshot wounds. So let's talk about what parents need to know. Before I delve into this, supportive homes and communities are the biggest protective factors for children against adverse experiences. So please know that your role is so important throughout your child's life, but especially heightened during this pandemic. I want you to know that where some of these statistics are very grave, the majority of your children are going to be very resilient during this pandemic. They have supportive home environments, support systems, and they are going to do just fine. This doesn't mean that they're not going to have days where they are very much struggling, but they are going to develop some resiliency here. Focus on helping your child navigate uncertainty and change, helping them understand as much as possible if they're going in and out of periods of quarantine, helping them understand how the vaccine could potentially be a game changer for this pandemic. Helping them understand those things and working through those things is very important. As much predictability as you can provide, do that. Knowing that is hard during this time. Also, help your child develop a plan for letting you know when they're not well. And we're going to talk about a safety plan and the components of a safety plan in a few slides. But I think it's important to have that discussion with your child. How would you let me know when you're not feeling well? What would that look like? Also know that children and adolescents are not able to participate in major milestones. There's lots of things that have gotten, altered: graduations, birthday parties, sporting events. I know for my daughter's middle school graduation to high school, we did a graduation parade with the cars. And where that was very, very different, and she wasn't able to hug her teachers or her peers. We did a lot of FaceTime, we did a lot of cheering, we did a lot of positivity around that, knowing that this was an altered celebration because we're in a different time. It's just important for you to heighten your support during these times because they need your help navigating. Help them also be a part of the solution. And again, I said this, keep them updated on things as they change and based on their developmental level. Find alternate ways, again, to celebrate milestones and involve your child in that creative, whatever that looks like. Again, that may be birthday parties via FaceTime. That may be, different examples of staying safe and remaining safe, but also allowing them to feel like it's still a special event that you're acknowledging and that's important. So again, know the symptoms and behaviors that require immediate attention. We talked about some of those signs and symptoms. Again, don't panic if one day your child is irritable or they're sad or they're more anxious. Look at, if those are more days than not, if they're starting to withdraw, if it's starting to impact their ability to connect with friends, connect with parents, or their ability to function in school, that's when you need to look at getting your child help, and we'll talk about that also in some more detail. Please do talk to your child about whether or not they're having thoughts of self-harm. Just by talking to your child about these things doesn't mean you're going to put ideas in their head, and I think sometimes that's a myth. Talking to your child about thoughts of self-harm and how they're feeling could potentially save their lives, and often does. So I highlight that. Please, 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 you don't have to be a mental health professional to have a conversation with your child and create a safe space for them to talk about how they're feeling. Let them know that you are their biggest advocate. Again, encouraging them to talk about their feelings helps lessen the stigma often associated with talking about mental health. If they feel like they have a safe space with you, they are going to feel much more open to discussing, how they're really doing. And if you feel like they can't open up to you, find someone that they are close with that they can open up to. Maybe that's a coach, maybe that's a pastor, maybe that's their best friend. Find someone that they can open up to and share those feelings. When in doubt, please get your child mental health care or treatment and allow them to be involved in this. It's really important. Allow them to be involved in what that mental wellness plan would look like. What kind of counselor would they like to go to? What would make them feel most comfortable? What do they feel like would be most helpful to them? Recognize that children are not fully cognitively developed, but they have an increased success in response to intervention. They are highly susceptible to change. This is what makes working with kids and families so rewarding. So symptoms and behaviors that may require some immediate or do require immediate attention and when to seek mental health treatment. If your child's exhibiting a complete loss of interest in activities that once brought them joy, please pay attention to that. Loss of interest is particularly heightened for adolescents if they are losing interest in interacting with their friends or their social groups. If you're noticing that your kid is coping by self-mutilation, cutting, burning, in younger children, sometimes this might be banging their head. Those are clear signs that they need immediate intervention. If they're verbalizing they wish they were dead, life's not worth living, sometimes this is not always going to be direct. Sometimes it's going to be through artwork. Sometimes it's going to be through social media. Sometimes it's going to be through journaling. So pay attention to all of those things that they might not be saying verbally. If your child is exhibiting feelings of hopelessness, in younger children, this might look like periods of extreme regression. And again, I say extreme. Inability to sleep, losses of appetite, acting out behavior that's not just occasional, but things that actually impair their ability to function or their ability to be safe. If your child is wanting to be alone, or for younger children, this may be not being able to leave their parent's side without extreme anxiety. These are things that you need to pay very close attention to. Understand that brief periods of stress and mood changes, again, are a normal part of child and adolescent development, but long-lasting mood changes and impairments in functioning need to be taken very seriously. And I always say, when in doubt, please seek help. So child and adolescent suicide, as unfortunate as this is the second leading cause of death for children and adolescents and young adults ages 15 to 24. Our community here is not immune to this. Suicide attempts for younger children are often associated with more impulsivity. So if they're unable to manage stress, anger, grief, frustration, sometimes that very next impulsive act is self-harm. For teens, oftentimes what you see is suicides kind of often associated with stress, self-esteem issues, bullying. We get a lot of that. There are a lot of transgender youth in our community that are really struggling with depression and increased rates of suicide attempts. The majority of children and adolescents who do attempt suicide, and I want you to understand this, do have a significant mental health disorder, and that is usually depression. Suicidal thoughts and feelings, again, these are highly treatable mental health disorders. You know, they are responsive when recognized, diagnosed, and treated. So please understand that. The earlier the intervention, the best chances you have of saving the child's life. Also understand that self-harm by cutting, burning, or other forms of self-mutilation doesn't always mean that your child is having suicidal thoughts, but it does mean that this constitutes a mental health emergency, and you need to get your child, in this situation, to the nearest safe place possible. Risk factors associated with increased risk of suicide. Again, I talked about depression. If there's family histories of suicide attempts or mental illness in the family, children who have been exposed to repeated violence, children who exhibit aggressive or disruptive behavior, access to firearms, bullying, feelings of hopelessness or helplessness, and acute loss. So we talked about some of this verbal and nonverbal warning signs. So some of the verbal warning signs could be things like, I wish I were dead. I don't want to live anymore because everyone hates me. And I am a burden. Soon I won't be a problem for you. But there's also more commonly those nonverbal warning signs. So chronic sadness, withdrawal from peers, loss of interest in activities, thinking about death or dying. They're no longer planning for the future. Giving away personal items that may have been meaningful. You also may commonly see frequent somatic complaints, headaches, stomach aches. Talking to your child. I highlighted this. Please talk to your child about depression or thoughts of suicide. Again, this does not put thoughts in their head. This is having a candid discussion with them, helping break down the stigma, helping them feel like they have a safe space and that you are their biggest advocate. So things that you might ask them, are you feeling sad or depressed? Are you thinking about hurting yourself? Have you ever thought about hurting yourself? Do you have a plan? For younger kids, this may be engaging them in things developmentally. Help draw me a picture about how you're feeling, engaging them in play so that they can, act out how they're feeling. Or just simply sitting at their bed and saying, hey, you seem down, let's talk about it. Maybe I can help if I understood how you were feeling. So what are the next steps for parents or caregivers if you are noticing that your child is exhibiting signs and symptoms of depression or anxiety, or having thoughts of self-harm? Don't delay getting help. This is the biggest thing. Contact your pediatrician, your local mental health resources for immediate interventions. Don't leave your child alone or allow them to isolate. Don't allow these symptoms to get worse, or think that if you just give them some space, they're going to get better. Again, these are symptoms, and these are, for them, they're things that really need to be taken as serious. These are, again, disorders that are highly treatable. Okay. Don't downplay feelings of suicide or sadness as just a normal part of adolescence. We know that adolescence is a time where kids can bounce back between moods, but if they're really exhibiting feelings of suicide and extreme sadness, that's not a normal part of adolescent development. Again, let them know that you support them, and also help them understand that feeling better is a process and it takes time. So that doesn't mean that they get to their pediatrician, they talk about how they're feeling, and then overnight they feel better. Help them understand that this is a process. Help them understand that if they need to see a counselor, that this is a process, and help them be involved in that. What does that look like? What do they feel like will help them feel better? If your child is exhibiting any of these symptoms, please secure items in your home. And I can't stress this enough that we have had more overdose attempts even with younger children because of just over-the-counter medications, those Tylenols, those aspirins that are readily available, in the medicine cabinet. If you've got weapons in your home, secure them. Create a safety plan. So safety plans are not contracts. They're just that. They're a safety plan. They're a, let's create or develop a series of actions that we will do if in the event that your child is in a crisis. So decide when to use the plan and involve your child in this plan. They should help you write this. So this is, what situations, thoughts, or feelings would trigger, initiating this plan? When will we use this? Your child may say, well, when I'm starting to feel more anxious. What are the coping strategies that your child finds most effective? And if your child doesn't have any coping strategies, this safety plan can be done with a counselor. This should be done with your counselor and with the family and child input. Everybody should have a part in developing the safety plan. How does your child comfort themselves? Is it their favorite blanket? Is it their favorite book? Is it, again, reaching out on FaceTime to a friend? What helps them in these situations? Help your child identify reasons for living, pets, friends, parents, activities. Help them also list people they can contact when these thoughts or emotions start feeling overwhelming. So this means I'm going to call mom when I'm feeling like I can't be safe. How help them with this plan and how to make themselves safe. So if your child is, let's say, in a digital academy, or they come home after school and you're still at work, what will they do to make themselves safe until you can get there? I will go to my friend's house if I start feeling like I'm going to harm myself. Again, knowing that a safety plan is not a contract. It is a series of things that are put into place to help your child not go into a crisis, to help your child to be safe until you can get them to appropriate mental health care. So I leave with my favorite quote by Maya Angelou: each child belongs to all of us, and they will bring us to tomorrow in direct relation to the responsibility we have shown to them. I think the fact that all of you are on this call today shows obviously an investment in your child and the children in our community. And I really, really appreciate you being here. It does take a village. Some of the community resources that I want you to be aware of: Tallahassee Memorial Behavioral Health Center. We have a child and adolescent inpatient floor here. We start taking kids at the age of 6 to 17. We also do offer for outpatient services the ability for in-person psychiatry visits, but also doing telemedicine for those who are still not, wanting to venture into an office. We also have a direct admissions Monday through Friday from the hours of 8 to 5. And so if you feel like your child is experiencing a mental health crisis, if you're not sure if they're having a crisis, if you can't get your child to open up and you feel like you need some help in deciphering what's going on, you can bring them in. There's no appointment necessary. You don't have to call first. Walk in and they will see a mental health professional, and a psychiatrist will perform an evaluation. The Apalachee Center, they also have a children's inpatient unit and outpatient services for children. And they recently, for couple months, they now have the FSU Behavioral Health at Apalachee Center, which does outpatient services for children in our community. So with that, we will open it up to the Q&A feature. Okay, so the question we have is, where is TMH Behavioral Health Center located? So we are at 1616 Physicians Drive. We are actually on the same campus as Tallahassee Memorial Hospital. So we are about a block away from the hospital. So we're getting a question: should I seek counseling for my 11-year-old or accept that the pandemic is part of the problem and wait? So I am of the mindset to be as proactive as possible. There is no harm in getting your child at least evaluated to see if there's something more serious going on. If you're noticing that your 11-year-old is having significant impacts in their ability to function at school, if they're not opening up at home, if they're withdrawing from peers, if they're exhibiting any of those risk factors, I think rather than just saying, this could be due to the pandemic, which it may largely be, I think it's really important to get them at least evaluated. We have another question: how do I help my oversensitive 9-year-old handle big emotions over minor things? So 9 is a special age, right? And so again, with your 9-year-old, you have to figure out what works for them, right? So if you feel like they're exhibiting big emotions over things like schedule changes or routines, help them understand why that's happening, help give them some predictability, help find things that reassure them. And again, understanding that 9 it's a challenging time, and it's teetering on that, that early adolescent period. So knowing that some of these things are going to be kind of normal, testing the boundaries and mood related things. But again, helping them develop positive coping skills and finding what works for them to develop some predictability and control of their world is very big. Am I going? We're figuring questions out here, guys. Bear with me. This one? Okay.
All the way up,
Chat. Okay. Okay.
And that starts with how long?
I think there's a question of how long would you expect it to take before therapy starts to help an adolescent who is experiencing anxiety or depression? Is it a month, 6 months, a year? So this is interesting because there's not a one size fits all for therapy, right? What I will tell you is the greatest predictor and success for therapy is a child having rapport with their therapist. So they have to have that rapport before therapy can even be effective. So help them find somebody they can really develop rapport with. And this doesn't mean that you have somebody who's not a therapist that's going to be tough when they need to be, but it's also a therapist that's going to be their biggest advocate and help them really work through some challenges. And so every child is different. It's not a one size fits all. So, what you should notice though is, and should be developing with your therapist, is treatment plans. So there should be treatment plans that have pretty concrete goals and objectives that you would like to see your child meet. And so you should start to see some measurable changes within 3 to 6 month intervals. So the next question is, my 15-year-old daughter started becoming socially isolated and confined herself in a room. She is irritable and doesn't talk to us. Should I bring her into the clinic? And again, my response to this would be to I'm definitely more on the side of being proactive. So if you've noticed that your 15-year-old, that this is not typically her disposition, if she's typically kind of gregarious and happy and sort of, engaged with peers, then this would certainly be a considerable change for her. And so, yes, I am always, again, I'm a big proponent for being more proactive. We got a question about, is increasing video game time okay if that makes my 8-year-old feel better when he is interacting with other gamers around his same age? I think if video gaming is a positive coping skill for your child, I'd say do not take it away. If that's where he's also finding some peer connectivity, I think that's a great thing. I also think it's just as equally important to offer a balance, right? So, I'm a big proponent of setting time limits with certain things. There's a time limit, or you do certain chores to earn this much video time. And then after that, we're going to engage in some other positive coping skill. Maybe that's getting outside and playing ball or what have you. But as we indicated, children have to get some peer outlet there. And if for your child that's a way to stay engaged with other peers, I would continue to allow that. Okay, the next question is, my child lost a grandparent. Very sorry to hear that, before the pandemic, and it made a comment in the lines of, quote, if I'm not here, I don't think anyone outside the home would care, end quote. They are very to themselves and get irritated when anyone tries to talk. Will counseling be beneficial? I would absolutely hope so. That would be the goal. And I don't know the age of the child, but the loss of a grandparent can be detrimental. And so it sounds like what your child is experiencing is grief. And children need help working through that grief. There are a series of stages and progressions we go through with grief. It's no one size fits all, but I think it would be beneficial to have someone help your child work through these things. I think, so we got a question about, what are some of the differences between frustration and struggling? What are signs, buzzwords, or phrases that my child might be using to indicate a struggle or asking me for help, but they're not saying it? Again, there can be a fine line between frustration and struggling. If you're noticing that your child is having, again, difficulty functioning, if things are in terms of learning, peer relationships, family relationships are all being impacted, that's probably a clear-cut indicator that there's more of a struggling going on here than just a frustration and irritability. Pay attention not only to the verbal things they may be saying, but again, the nonverbal cues. So, what are they doing to demonstrate to you that they're struggling? Is it in those areas, again, where their grades are suffering? They don't want to be engaged with peers. Pay attention to those things. Also, again, talk to your child. And if you don't think that your child can open up to you, then it's imperative to get them to somebody that can. Sometimes parents are always the last ones to know. I know that that's a reality, but you have resources to utilize. So asking your child, You know, are you just feeling frustrated because, you know, you're at doing digital academy right now, or because you've just integrated back into school? You know, tell me what's going on. Tell me how I can help. And again, if they're not opening up to you, then yes, I would seek guidance from a mental health professional. Again, I'm going to tell all of you guys I'm on the more proactive side when it comes to kids, because there's a lot at risk here. So I think we got a question about, can you suggest ways to get teenagers to unplug from their electronic devices without them seeing this as punishment? Again, you know, you have to find out what works for your teen, right? What motivates them. So are there ways that you can engage them in their electronic devices but still get them to unplug a little bit? So I know that there's a lot of positive and negatives about TikTok and the media, but I know for my kids, they love music, and that's a form or outlet for them. And so, yes, I have engaged and delved into their world to, as idiotic as I look, to try to learn some TikTok dances so that I can integrate and be a part of their world, but they're also unplugging a little bit by having some family involvement. Again, finding out what motivates them. And sometimes it's just simply saying, hey, we're going to put our phone down because I want to spend some time with you. Let's go for a walk. They may not like it. You know, they may not be super, yeah, let's do it. But, you know, as parents, we have to make some of those difficult decisions. The other thing is, again, I'm a big proponent of earning your electronic time. So, you know, you do X number of chores and here's how much time you can have in your electronics. Kids start to develop a sense of, you know, how much you have to do to earn that time, right? So again, you know, I want you to know that it's important to allow them to engage in their electronic devices, because those aren't going anywhere. But are there ways that you can engage in that with them, or find diverse ways to do that? Okay, so we got a question. How can I find the best counselor for my child's specific needs? My high school senior's grades have plummeted. She is stressed. She just told me she thought about killing herself. She also has gender issues. So the first thing that I'm seeing about this is the first warning sign to me is thoughts about killing herself. So I want to make sure that safety is first. So if she's currently having those thoughts, stabilizing that would be the first thing. From that, there are a ton of resources in the community, you know, in terms of counselors. It's really about finding what counselor specializes in what your child is struggling with. So if your child is struggling with gender issues, and with that often comes a higher levels of anxiety, depression, then there are counselors in the community that specifically, you know, they will tell you in their bios that that is what they specialize with. Also finding out what age group. So they specialize in adolescents with gender issues. You know, gender identity issues are becoming we're seeing more common, that being more commonplace, and these kids are really struggling. I know that's a very significant issue, and I know as a parent that can be very challenging, but there are counselors that, again, they do specialize in those things. You can also call your insurance providers, panelists, and you can ask them who that they credentialed on their panels that specialize in different things. And when in doubt, again, utilize us as a resource to help you if you can't find a therapist in the community that is appropriate for your child. We got another question. Are you finding any differences related to ED visit reasons between adolescent boys and girls? This is interesting. I will tell you that for boys and girls in the adolescent realm, we do have girls that higher prevalence of females that are struggling with issues related to bullying, self-identity, self-esteem. And some of that is also attributed to sometimes vulnerabilities and prior traumas. So I want you to understand that too. We do see ED visits with boys, but it's usually the primary thing that you're seeing is some sort of behavioral disturbance. And so usually that's what you see first. And then when you delve down underneath that, then you start to unpeel some of the layers of what's really going on there. But boys are not immune to also issues with self-esteem and identity as well. What you see across the board with adolescents too, with boys and girls, is reactivity to breakups and relationship issues. And you see that on both sides. Sometimes we got a question about sometimes insurance plans limit who people can see for mental health. Any ideas how to deal with that, particularly an issue with kids on Medicaid? So there are more resources now for kids with Medicaid. Apalachee Center actually sees kids with Medicaid, various Medicaid plans. And we have the community action teams, the CAT teams, which is a big investment with the community to make sure that the kids on Medicaid have availability of services. So I'm hoping that that helps some. And if it doesn't, and you're finding difficulty finding a therapist for your child, again, please utilize us as a resource. We can point you to some areas. Also, the Apalachee Center, at FSU, also is an available resource there as well. We got a question, is the ED the same as the ER? Great question, actually, and yes, it is. It's emergency department or emergency room, and I'm sorry, I may have used those interchangeably, but great question. Yes, they are the same thing. So this is the last question. Are there any other virtual resources you could recommend to combat isolation during this time? What we can do is actually provide you with additional resources Morgan, through our Facebook group. Yes, there are lots that I would recommend. There are a ton of virtual resources with the CDC, but there's also a ton with NAMI and other organizations that specifically specialize with mental health, both with children and adults. So yes, we will provide some additional resources for that. That's a great question. Thank you everyone for joining us. I really appreciate everyone's, these questions have been great, and good luck. And I hope that we can continue these discussions so that we can continue to support the kids in our community. Thank you.